me, it is very clear that not only am I a danger to myself, I'm a danger to the patients that I take care of. I cannot be in. I don't know if I can ever be that person that can be in a role of bedside care.
We've got a nurse who loses his license and loses his license again. So the first time he loses his license was in 2015. And depending on what you did, it may give you a chance to come back. You can apply for reinstatement, but as we've seen in previous cases, you have to show why you should be allowed to have it back. I've gone to therapy, I've worked in a healthcare adjacent job, I've done this, I've done that, I have a support system now. Even if I get stressed out, I'm not going to fall back into my old ways. This gentleman loses his license for diverting, one of the most, I would say, top 3, if not top 1 reasons for losing your license. If you don't know what diverting is, it's taking medication from the patient, namely pain medication. So this gentleman gets caught for diverting, not once, not twice, but 3 times, perhaps all at once. I can't imagine they caught him like 3 consecutive times. He gets caught 3 times, 3 different hospitals, mind you, loses his license. Now, what do you do when you lose your license? It's not about nursing anymore. It's about getting yourself together and figuring out what went wrong that they deemed you were a danger to the public. This gentleman goes to rehab. 90 days. 90 days in rehab. Gets out. Relapses. Oh, I'm in the way. Relapses. Fortunately, this gentleman had the opportunity to go back. He goes back for a full year inpatient. 1 year. So if you've got a guy looking for reinstatement, he's done a year inpatient. Is that enough? Not yet. We need some more. So he goes, and in 2019, works as an office manager. Something we see very common. And I think it's a great position. It's a good way to make some decent money if you don't have your license anymore. But there is a caveat. You can get in trouble. And anytime someone's applying for their job back after having worked as an office manager, the board is going to grill them on it. Really grill them on it. They want to make sure they're not signing anything. Because you know and I know, those home health agencies are not looking up the nurse to make sure that their license is valid. It's assumed, right? So if there's a form that needs signing, you need to make sure that you're not signing it, and that temptation may be there, oh, we just need it signed and we can get it moving, but you don't have a license anymore, so you can't do that. And they're gonna ask you about that. So you've gotta be real careful you're not working for doctors that are gonna push you to do things that are no longer legal for you to do. Sounds like he was fine. They were okay. They gave him his license back, which he states is the best day of his life. He gets that back in 2022. Unfortunately, this is where the good news sort of ends. He goes back, and it's not long before he gets caught diverting again. So we get caught diverting. He states that he basically goes radio silent. Charge nurse has to go find him, so on and so forth. In any case, he sobers up. He's going before the board in 2024. This is when the video footage is from. It's pretty recent, just a few months ago. And the reason he's going before the board is to see the disciplinary action. So from the moment he was caught, his license, he's no longer allowed to work. He has to go before the board to see if he can keep his license. Now the writing's on the wall. He's already had, in his words, 5 or 6 chances. So he goes before the board and he says, I would like to work in a job that does not have exposure to controlled substances. I don't have it within me to stay sober. The temptation is too strong. Which, to be fair, I don't think they would have given him that job anyway. I don't think they would have allowed for that. But here we are. So that is his proposition. A non-controlled environment, non-controlled substance environment. He gives a very emotional plea, which as nurses, we're all empathetic, right? We generally by nature have a lot of empathy. So it's tough to see that. It's tough to see a person in their absolute ashes of their career trying to bargain for what's left or what can be saved of it. And you have an absolute pit bull of a board member who goes after it. And she zones right in on the patient. Do you feel that you were a good nurse when you didn't give the pain medications and you were operating intoxicated? So he goes forth, he loses his license, once again. And the question is, will he get it back? You can comment down below, but I really don't think so. I think that nursing is really good about giving a second chance. And he had a second chance and he wasn't able to, because there's going to be a huge liability. I feel like it could come back on the board. It could come, at the very least, in a very poor light. And if he were to come back and cost someone their life, and he said in his own words, if I'm near medication, I'm a danger to myself, I'm a danger to others. So it's just a tough case all around, but there is some things to learn, right? So he loses his license due to a non-clinical issue. As a student, you really shouldn't be worrying about that. I don't think anyone's worried about losing their issue due to diversion, at least when they're in nursing school, right? If you're thinking about that, I would encourage you to leave the field. So again, once again, non-clinical reason for losing his job, goes on, gets a second chance, 8 years away from nursing. That's impressive. You know, I worked as an NP for 4 years, so 3 years away from nursing, went back to it like riding a bike. Little different because I was still working in medical, around the terminology, all of that. But he said the same thing. It was kind of like riding a bike. He didn't miss a beat when he came back. So I want you guys to not worry if you're going to go on maternity leave, paternity leave. Not a real issue. Don't worry about that. You're going to be fine. It'll come back quickly. So also to learn here, if you find yourself in that position of losing a job, generally going to be good that you want to get a healthcare adjacent job, use your skills in a peripheral way, and then if you find yourself down here, it's pretty much the end of the road for nursing for you. So I hope you liked the video. I hope you like the new concepts here. We're throwing stuff at a wall, seeing what sticks. Let us know.
The hearing panel does find that the clear and convincing evidence showed that you clearly did violate the terms and conditions of your previous order and conditions and stipulations of your restoration of your nursing license. And with that, they find that the appropriate disciplinary action at this time is to revoke your license. This time, the hearing panel, and I'm phrasing from what they said, thinks you need to focus on yourself and just really concentrate on your sobriety and getting better. But as you stated, many chances have been given. And at this point, the hearing panel has voted for revocation.